Today we'll talk about high blood pressure or hypertension. So a lot of patients know hypertension as high blood pressure, and that's accurate. They take the blood pressure with the blood pressure machine and they get a number. If it's high and they take tablets. Now it's more complicated than that, right? Blood pressure in the body is the pressure in the blood vessels going away from the heart. Those are called the arteries. So as you'll see here, these blood vessels could go to the brain, they go to the heart, they go to the kidneys, they go to the eyes. Those are some of the major ones. Now think about the tire again. If the pressure is too high in the tire is going to burst. If the pressure is too high in the brain, what's going to happen? You're going to get a stroke. If the pressure is too high by the heart, you're going to get a heart attack. Pressure is too high by the kidneys, you're going to get kidney failure. Pressure is too high by the eyes, you're going to get eye damage or blindness or vision loss. So these are some of the complications of high blood pressure. And this is why high blood pressure is so important. Just like with diabetes, right? It's not just diabetes alone, it's not just high blood pressure alone. We want to prevent patients from getting the complications of high blood pressure. And what makes it more difficult is that the symptoms of high blood pressure, this is it, nothing. There are no symptoms of high blood pressure. There's a common misnomer among patients that if I have a headache, if I have neck pain, my pressure might be high. But I myself may have high blood pressure. Now, you're feeling perfectly normal. It may be, let's say, 200 over 100, let's say. It might be very high, but I'm feeling perfectly normal. And we've seen this in too many patients. If you wait until you get symptoms, the symptom you may get is a heart attack or a stroke or kidney failure or blindness. You may not get another chance because a lot of patients die the first time they get symptoms. But you may get another chance, but you may have a stroke and then you can't walk, you can't talk and so on. So again with diabetes, high blood pressure or hypertension, when we're going to treat you with a long-term investment in your health again, we want to prevent all these complications. So we'll talk about treatment later on, but we want to take medications every day to prevent these things. Now when we talk about hypertension again, it's just like diabetes again. It's associated with a lot of other conditions. So it's associated with diabetes, with high cholesterol, high fats, obesity, or being overweight. Now, high blood pressure is a big risk factor for heart attacks. Now, diabetes is a big risk factor for heart attacks. Having high cholesterol is a big risk factor for heart attacks. Now, if you think about this, if you think about a patient who has diabetes and high cholesterol, they have two risk factors for heart disease. But as we mentioned in another video, it's the risk factor is not 1 + 1 is 2. You don't have a 2 times increased risk of heart disease. It's like 1 + 1 is 5. You have a 5-time increased risk in heart disease. So it's not additive, it's multiplicative. Now, if this patient with diabetes and high cholesterol, let's say, they know they have this condition, but they never check their pressure and they're feeling perfectly normal. There's a chance that this patient may have high blood pressure, but they don't know. And even if they are well treated in their diabetes or high cholesterol, if they do not treat their hypertension, which they probably was undiagnosed because they think they could only have high blood pressure if they have symptoms, they will still have a big risk factor for heart disease that they doesn't know about. So hypertension is associated with all the bad things: high cholesterol, high fats, diabetes, being overweight. And it's a silent killer. It has no symptoms, so you need to monitor. You can't just take tablets when you get when you get a symptom. You need to be checking it on a daily basis if you are known hypertensive, and then you show your doctor the numbers. Now, talking about the numbers, let's say you have this 122 over 84. Let's say we have that number. The top number is called a systolic. That's the blood pressure when the heart contracts or pumps blood. So when the heart pumps blood in the blood vessels, that pressure is the top number. And when the heart relaxes, that pressure is the bottom number. Both of these numbers are very important. And both of these numbers being elevated or high are associated with an increased risk of heart disease.
Causes of high blood pressure.
Now, the causes of high blood pressure, there's none. In about 90-95% of patients, there is no known cause for the high blood pressure. It just happens. It's called idiopathic. In a small proportion, there may be people with kidney disease, endocrine problems, and rarer conditions. But in a majority of patients, especially the older patients, high blood pressure associated is caused by it just happens, unfortunately. Right? If we have a young patient with high blood pressure or a pregnant patient, then we may look for something else causing it.
Diagnosis of high blood pressure.
How do you diagnose high blood pressure? We all know you wrap the blood pressure cuff here and you check it. Now that's good. So I want to talk about some things that you need to do to get an accurate blood pressure measurement. The first thing is you need a correct blood pressure cuff. So if you think about a person with a big arm, it could be a overweight patient, or let's say a bodybuilder with a big arm, and you use a normal cuff, a normal size cuff on that patient, what do you think is going to happen? It's going to be too tight. And if it's too tight for the patient, what is going to happen? The blood pressure is going to be falsely high. Now, if you do that, you are going to give this patient, you might say, okay, your pressure too high, I'm going to give you more medications, which is bad. because you're using the wrong cuff. In the same way, if you have a tiny patient and you use a normal size cuff, that cuff might be too big for the patient's arm. And if it's too big, it will underestimate or give you a falsely low blood pressure, which could also affect treatment. So you need a correct size cuff. They have normal cuff for bigger patients. They might have a large adult cuff. For smaller patients, they will have like a child and so on. We also show you how to put it on properly.
Demonstration of cuff sizes.
Right, so as you can see here, they have one size doesn't fit all, right? They have different sizes of blood pressure cuffs. So if you have a child, you would use this. If you have a normal adult, you would use this. And if you have a patient with a very big arm, you would use a large adult. So again, as we said before, if you use a too small cuff, let's say you use this small cuff on a normal patient, it will be too tight. Then the blood pressure will be falsely high and we'll give them too much treatment. So a couple of things we want to show you with the blood pressure cuffs. The newer blood pressure cuffs has this long line here, it's called the index. And when we wrap the blood pressure cuff on the patient's arm, we want this arrow to be between this line. If it falls between this line, then it's the correct blood pressure cuff for the patient. Right, we'll demonstrate this now. And also, this dot, as you know, is where the artery is located. And we'll show you where this goes as we put it on the patient. Okay, so we put it here. We make sure it's above the elbow. We don't want to be on the bone, wrapping on the bone. We want this dot to be just by this in the elbow joint. Right, as we wrap this one, I'm going to keep it here. As we wrap it, we want to make sure it's not over the clothes. As you can see here, in this patient, the arrow is just outside the white line. So this blood pressure cuff is too big for the patient. This arrow should be somewhere on this white line. So this means this is the wrong blood pressure cuff. So this will be the correct blood pressure cuff for this patient. You see the arrow? See the index line, we're wrapping it here, and you can see the arrow is falling between on the white line. This indicates that this is the correct blood pressure cuff for the patient.
Do's and don'ts when checking blood pressure.
Now the next thing is, when you're checking blood pressure, and this unfortunately doesn't happen a lot, you need to be relaxed. You need to be resting for 5 minutes before you check your blood pressure. You even need to be sitting properly with your back against the seat, with your foot against the floor. You actually shouldn't have caffeine in your system for half an hour before. You should have an empty bladder. A lot of different things that should be ideal, right? So those are two very important things. The blood pressure cuff, and you need to rest. Now, the common way you check blood pressure is when you go in the office, or some patients, which is good, would check their blood pressure at home. That is called home blood pressure monitoring, or out of office. So you're not doing it in the office, it's called out of office blood pressure monitoring. So now if you're doing the home blood pressure monitoring, that's excellent, keep doing that. But you need to do it properly, as I mentioned before. You need to record it. If for some reason, let's say during the day you have a headache or dizziness or a bad feeling, you need to check your pressure at that time, record it, and put in brackets, had bad feeling, had headache, so the doctor can interpret it properly when they see you. Now the ideal way we like to do it is to check your blood pressure in the morning, the evening, do it for about a week or so. When you go by the doctor may take an average or so on. But I mean, doing it 3-4 times a week is still better than doing it 0 times. So if you can record it, the home blood pressure reading is very, very important. Okay, so one thing to remember when you're checking your blood pressure at home is that we need to be able to trust your readings at home. So when you bring a book with your readings, it says 120, 130 and so on. We need to be able to trust those readings. How are we going to do that? Bring your blood pressure machine to the doctor's office. The doctor will check your blood pressure with your machine and his machine. If it's similar, then we know we could trust those readings. Right, so that's something that's very, very important, because sometimes these automatic machines give you false readings. And we always want to stick with the machines in the arm. Most of the machines in the wrists are not approved by the FDA and give you inaccurate readings. So we want to use the blood pressure machines at the arm.
White coat hypertension.
When patients come in the doctor's office, a lot of them are anxious. They're scared to see the doctor, you know. And that is what they call white coat. Doctors traditionally wear a white coat, right? I'm wearing red today, unfortunately, but doctors wear a white coat. So it's called white coat hypertension. So it's your pressure is too high in the office, but it's normal at home. So if it's normal at home and it's high in the office, the doctors most likely will treat you based on your home blood pressure, and they will diagnose you with white coat hypertension.
Ambulatory blood pressure monitoring.
Now, the ideal way to check the blood pressure is something called ambulatory blood pressure monitoring. Ambulatory just means you walk in, you're doing your normal daily activities. So what we do, and I know Dr. Sinner in office does it, we wrap the blood pressure machine on you, over 24 hours. It takes your blood pressure the same way like a normal blood pressure machine, but it's set for different intervals. So during the day, maybe every 20 minutes it'll check your pressure, and at night, it'll check it like every 30 minutes. So at the end of the 24-hour period, you may have about 70, 80, 90 blood pressure readings. So obviously, the more readings you have is a more accurate reflection of what is going on with your blood pressure. What it also does is to tell you what's going on with your blood pressure in the night, which is impossible to do by yourself. So if you wake up in the night and check your blood pressure, that is not considered a nighttime blood pressure. It's while you are sleeping. So the only way to get this information is if you do this 24-hour profile. Why this is important? Because usually the blood pressure should drop about 10 to 20% in the night. But if it drops too much, more than 20%, that is bad, and the doctor may want to do something. He may want to reduce your blood pressure medications in the evening. If it goes up in the night, that is just as bad, even worse, and the doctor might want to add a medication in the evening. So the only way to get that information is by doing a 24-hour blood pressure monitoring. You also get something called an early morning surge. Some people it's normal to have an increase in blood pressure in the morning period, but if it increased too much, that is bad, and the doctor will want to do something. Now that is ideal. It may not be always practical for some patients because of cost, and they can't do it because they work and so on, but it's normal checking your blood pressure, and you're doing normal activities, and it's the ideal way to check your blood pressure. So those are some other ways we could check your blood pressure.
Treatments of hypertension.
Right? Now, treatment of blood pressure, the cornerstone is still lifestyle. Diet, exercise, salt intake, stop smoking and so on. Healthy diet, fruits, vegetables, about 30 minutes of walking 5 days a week. And usually when we see a patient, we will give them basic advice, but we want them to see a nutritionist or a dietitian because they are the experts in the lifestyle management. Now, when it comes to tablets, now we mentioned blood pressure, you get a number. Right now, most societies are talking about over 130, over 80 is considered high blood pressure. So if you consistently, and that's a key word, it's not just one reading. If you consistently have readings like on 2 separate occasions where the doctor check it a couple times and it's always 145, 150 and so on, the top number, and they diagnose you with high blood pressure, then we will treat. Now treatment is a little bit complicated, but just for diabetes, you have to talk to the patient because it depends on the cost. Some drugs are expensive, some drugs are cheaper. All drugs have different side effects. Common drugs like enalapril and so on will increase your potassium. So if you have that problem, which not all patients have, you may have to stop it. Drugs like enalapril and so on will cause a cough in some patients. A lot of patients tolerate it well. If you get the dry cough, we stop it. So it depends on the side effects, it depends on the cost. A lot of doctors now like to be more aggressive. That's a newer approach. So we like to start 2 medications that work differently in your body, right? It has a synergistic effect, and we like to start it at once. Ideally, if you could get those 2 ingredients in 1 tablet, so that's called a single pill combination. So it's 1 tablet, but with 2 blood pressure medications, or even 3. That's ideal because the more tablets a patient has to take, the less likely or less compliant the patient is going to be. If a patient has to take 1 tablet that will last a whole day, that is better than asking a patient to take 1 tablet morning, 1 lunch, 1 evening. The more frequent the patient has to take it, the less likely they are to remember or to take it. So we want to make patients' life easy. Unfortunately, those single pill combinations would be a little more on the expensive side. So there are always pros and cons that a doctor will talk to you to decide what kind of treatment we want to use. Right? So with these different things, I hope these basic concepts would help you all in managing your high blood pressure and understanding it. And look forward to seeing you all soon. Thank you.
Call us today. Progressive Health Services, 747-5297 or 308-3370. We're located in Chin Chin Road, Cunupia.